Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. We know that burnout is a common problem in society today, and it accounts for an increasing number of disability claims. So the increasing demands of our fast-paced life, coupled with multiple responsibilities and demands from various dimensions of our life, is really at the root of many cases of burnout, as you would suspect. So here's the official definition of burnout. It's the subjective perception of chronic demand-related stress with subsequent emotional exhaustion and decreased performance in work-related or self-set tasks. So not only are you not performing as well at work, but even in the tasks you're setting for yourself to get accomplished, it's all falling apart. So the symptoms include not only changes in mood and emotional well-being, such as fatigue, cynicism, impaired sex life, lack of concentration, or a general negative attitude towards work, but also physical symptoms such as headache, spasticity or rigidity, and even irritable stomach problems. So studies show that burnout increases the risk for subsequent development of serious mental and physical disorders, including depression, anxiety, and cardiovascular conditions, which are the most prevalent conditions associated with a history of burnout. Now, this is what I want to tell you, that in recent years, researchers have performed a number of clinical trials with patients diagnosed with burnout by giving them an herbal supplement known as Rhodiola. Now, Rhodiola is an herb that's classified as an adaptogen, as studies show that it mitigates the effects of stress on the body and the brain via multi-dimensional mechanisms, such as reducing the secretion of stress hormones like cortisol and preserving the balance of key brain neurotransmitters that are responsible for mood and reward and cognition. When organisms are under stress, these things remain in balance to a greater degree. That's what the experimental evidence has shown us. So this 2017 study really caught my eye. It was published in the journal Neuropsychiatric Diseases and Treatment on March 22, 2017. Now, in this study, researchers treated 118 male and female outpatients aged 30 to 60 years of age who were suffering from burnout symptoms. So the subjects all had similar daily stress burdens, such as, home caring of a handicapped or demented family member, on top of all the related stresses of daily life. So the patients, this is what the treatment consisted of. The patients ingested 400 milligrams a day of a standardized grade of Rhodiola rosea extract over a 12-week period. And the study results were very impressive. So as reported by the researchers, subjective stress symptoms underwent significant improvement, which suggests an increase in coping ability and a decrease in subjectively perceived demand after the intervention, after they used the Rhodiola. So a significant percentage of patients reported improvement in these following specific parameters. Lack of joy. All of a sudden, they felt a little more joyful. Loss of zest for life. Their zeal started to come back. They reported improved alertness, a greater sense of personal accomplishment, and improved interest in sex, combating sort of the stress-induced impairment of sex life. So some of the patients experienced improvement in these symptoms as early as the first week of treatment with Rhodiola supplementation. And the majority of patients saw clear improvement in a variety of burnout symptoms over the course of the 12-week treatment session. So the researchers note that other trials evaluating the effects of Rhodiola extract in improving physical and mental performance under stressful conditions confirm and support the findings that they saw in this study in 2017. So my note would be that if you're thinking of using Rhodiola supplementation to help combat symptoms of burnout, first speak to your doctor and then make sure you use a Rhodiola supplement that is standardized to 3.5% rosavine's content to ensure that you're getting enough of the medicinal ingredients from the 400 milligram total daily dosage that's recommended. So I've included a link to the research study below. I think you'll find it quite fascinating. So thanks for watching, and I'll see you next time.